Hi everyone, this is Rebecca Konasek and this is Conversations with the Doula. I'm going to give it a few minutes like usual to let people join us and then we will get started. I'm in the office today, so the background's a little bit different than usual and the lighting's a little bit funky, but I like it better than the big fluorescent lights that we have in here. So I'm gonna do a little bit of a refresher on who I am while we're waiting for people to join us. So again, my name is Rebecca Konasek and I work as a doula and enrollment supervisor for Shawnee Health Service in a home visiting program called Healthy Families Illinois. So we serve mainly first-time moms in Jackson, Perry, Franklin, and Williamson counties. And I work mainly as a doula alongside Chastity, who was in the video that we did last week. And we offer support during pregnancy, labor and delivery, and postpartum for new moms. And then they can continue on in our program from there up until their child's about 5 years old. I'm gonna give it just another minute. Today's topic is gonna be what to expect like immediately after delivery. So this kind of ties in a little bit with what we talked about with postpartum care, but this is a little more focused on like what happens right after a baby's born, baby being placed skin to skin, what that looks like in those first few hours, and then sort of what to expect for your time at the hospital from there. I wanted to sort of plug into that I saw this week that SIH Carbondale Memorial has added some like online portal, like webinar type things that you can do to access like labor and delivery education, breastfeeding education, new dads, sibling things for getting your siblings ready for a new baby. Different kind of topics, and so you can look on their online portal and choose which ones you want to learn about on your own time, since they can't offer labor and delivery support in classes in person right now because of COVID. So definitely check that out. That's where I've gotten a lot of the information myself for different things that go on at the hospital and to sort of be familiar with different things happening so that I can help educate my clients. So I wanted to start by saying Carbondale Memorial is a baby-friendly hospital, and this is an initiative that all hospitals across the country kind of strive to get, and Carbondale got it, I think, in 2015. They got that status, and it's a really big honor to have, and so this means that everything that they do once a baby's born and really during your labor and beyond is going to be to support your breastfeeding experience and to help you have the best start to breastfeed that's possible. Doesn't mean that you have to breastfeed. You can absolutely still formula feed. It just means that everything that they're doing is to support breastfeeding, because there's a lot of things that can happen for people after labor that can actually deter breastfeeding. So that's what that means. And part of that is that you get this golden hour after a baby is born. So as soon as baby's born, they're gonna go straight skin to skin with you. They might put down like a receiving blanket or something to kind of have there to dry them off right away, because babies are born wet and then they get cold. So they wanna maybe dry them off real quick, but they're gonna be skin to skin with you. They'll put a nice warm blanket over you guys and kind of keep you nice and snuggled up. Being skin to skin is the best place for baby to be. It's gonna help them regulate their body temperature faster and better, and also help them with their blood sugars to sort of level out. So it's really healthy for baby. It's the best thing, makes all sorts of hormones release. That stimulation helps release oxytocin, which helps your uterus contract, which helps control bleeding, helps release the placenta, everything like that. They might put a little hat on baby to help keep them warm, but that's usually all that's gonna go on baby. So you get this golden hour that's just for you and baby to get to know each other and bond, and it's really, really, really special, and I really encourage people to take advantage of it. They're not gonna weigh your baby or take baby from you unless something's wrong. And so unless you specifically ask your nurse to go weigh them or measure them, they're going to let them just be with you skin to skin. And they might even say, if you try to say like, hey, can you go weigh my baby? They might be like, well, just so you know, the best thing is for you to have this hour uninterrupted, but if you want me to, we will. So it's always going to be your decision, but I'd really encourage you to take advantage of that hour uninterrupted because it's really special. So in that hour, babies play skin to skin. You're going to have the cord clamped and you can cut it. Partner can cut it. Whoever's with you, your support person, the doctor can cut it. It's totally your choice. You can do delayed cord clamping if you choose. And then the placenta is going to be delivered. Any sort of repair that you need to have, if you need stitches or anything like that, it's usually going to happen in that first hour, which is nice because you're holding baby and you're kind of distracted. If you do need any stitches or anything like that, they're going to give you an injection of lidocaine wherever they're going to do the stitches. So it will numb you, but it can burn a little bit whenever you first get that injection. So that's just something to be aware of. Let's see, what else? Right when baby's born, they're going to do an Apgar score. It's a 0 to 10 score, and that's a number that's telling you how baby's doing. It's done at 1 minute old and 5 minutes old. Most babies are going to be like a 7 or an 8 at 1 minute old, and then at 5 minutes old be an 8, 9. I've never really had anyone be like a 10, so don't feel like anything's wrong. But usually as long as it's above a 6, it's a pretty standard birth. If it is a little bit lower, something might be going on. They might need to do some extra suctioning. Baby might need to spend some time in the NICU, different things like that. So that's just something to be aware of. That number gets thrown out there. Apgar is a acronym. And so they're just looking at basically how baby looks, if they're turning pink, if their muscle tone is nice and strong, or if they're kind of like limp and weak, their respiration, are they breathing, is their pulse normal? Those kinds of things. They're going to continue to monitor your baby's temperature once they're born and make sure that they're maintaining a good body temperature. Obviously, elevated temperature would be a sign of some sort of infection or something going on, but typically baby temperatures can be a little bit lower. And so again, that's why it's important to be skin to skin with baby and help keep them warm. But if you have like a really cold room, since you were in labor 5 minutes ago, you might want to think about bumping up the temperature in the room a little bit to help baby maintain a good, healthy temperature. They're going to be monitoring your bleeding. So you bleed quite a bit after you have a baby, so just know that that's normal. They'll let you know if it seems like it's abnormal, and they'll do things to help control the bleeding. But that's something that they're sort of paying attention to with you during that time frame. They're going to continue taking your blood pressure, and they might even take your temperature as well to make sure you're not showing any signs of infection. Newborn appearance is something I wanted to talk about. This is something that can throw some people off because they've never seen a newborn baby before. And like, really, why would you? Because you probably have never had an experience of being in a labor and delivery room. So this is a good thing for dads to kind of be aware of too. Babies can have strange shaped heads, maybe like a cone head or something, if they've been in the birth canal for a little while. This isn't necessarily like a straight up and down cone head. This could be like off to one side or the other. It just depends how baby came down. Usually this goes away within an hour or two, and really settles down quite a bit. So, you know, don't be alarmed by it. A lot of times babies have a hat on anyways, so it might not even be that noticeable. They might be kind of swollen, have different bruising, birthmarks, sort of some strange colors. They can come out looking pretty purple, and then once they take their first breaths, turn to that more pinkish color, but their hands and their feet might stay sort of a purplish blue color. So just know that most of that's normal. If you have concerns, just bring it up to the nurse, but they're going to be doing these assessments throughout the whole time that you're there and checking on things. So it just kind of to be aware of some different colors. Crossed eyes is really common. So they kind of like do crazy stuff with their eyes, and this will stick around for the first couple of months. Babies cross their eyes all sorts of weird ways. Again, if you have concerns, bring it up to your pediatrician. But typically those first few months, they really can't see that well, and it just is them trying to figure out how to use their eyes. There's Lanugo, which is like this little fur that's all over babies. My oldest had a little bit on his ears, and like on the shoulders is really common. This is just a fur babies have while they're in utero that helps keep them warm whenever they're inside you. And so they sort of shed this away whenever they're born. It's super, super soft. I remember just like kind of like petting my son whenever he was born. It's very fuzzy. Peeling skin is really common around the wrists or the ankles, so don't be alarmed with anything like that. And then Vernix, which is like this white substance that's on babies. It's kind of like almost like a lotion texture, so a lot of times you can kind of rub it into their skin. Vernix is actually really good for babies. It helps protect their skin from any bacteria, and it helps protect them while they're inside utero again from all that fluid. But this is definitely good to rub into your baby's skin and leave on for as long as you can. So if you sort of avoid doing a bath for a while. You can do your first feeding in that first hour or two, whether it's formula or breastfeeding, it's definitely encouraged. And then once you feed them, they'll typically take them over across in the same room that you're in, and they'll weigh them and measure them, do their footprints, put on their armbands, and that armband will match your armband. There is an alarm system that'll go on them, and that is to prevent them from, of course, being taken out of the hospital before they're released. So if anyone gets too close to a door or a window, that alarm can go off, and that's something to be aware of. Anyone who doesn't have a matching armband cannot be alone with baby. So you have one as the mother, and then you get to pick the other person who gets a band that goes along with baby. So that's just something to be aware of. And then they're going to do any of the newborn procedures that they do. So they'll do a vitamin K shot, eye ointment, that's an antibiotic eye ointment that they rub on, and then if you want to do the hepatitis B vaccine. Some people wait and do the hepatitis B vaccine when they're at their first pediatrician appointment, or you can just do it right there at the hospital. It's recommended to do right at birth, but you have the right to refuse any of those things if you want to. I would definitely recommend looking at evidencebasedbirth.com if you want to learn more about newborn procedures, and sort of make a decision on whether or not you want to do vitamin K, eye ointment, or Hep B. There's a lot of really good research, but most people are pretty comfortable doing the vitamin K and eye ointment. So then once you're like maybe 3 hours postpartum, as long as everything's good with you and baby, you're gonna move over from labor and delivery to the mom and baby side of the hospital, and you and your partner both will go over there. This is a good time to eat something, so I recommend like calling and ordering some food from either down in the cafeteria, or if you want to have food delivered. Eat and rest for the rest of the time you're there. Really, that's your job, is just eat, rest, and take care of baby. It's baby's job too. They're going to continue to monitor you. This is happening a lot more frequently at first, and then it'll cut back to like every 4 hours once you're there a little bit longer and things are looking good. They're going to keep checking your blood pressure. They're going to push on your belly. It's pretty uncomfortable, but just try to be, nice with your nurse. They have to do it. It's to check and make sure that your uterus is contracting back down to its normal size, and that your bleeding's controlled and you're not hemorrhaging or anything like that. So that can be kind of uncomfortable. For baby, they're really just going to keep monitoring their body temperature and their heart rate. They're going to kind of check in and make sure that baby's eating okay, help you with anything with that. They do have a whole lactation team at the hospital. The nurses are trained to help with lactation. That's part of that baby friendly initiative. So if you need help and support with breastfeeding, you definitely want to call lactation to come help you when you do a feeding. Take advantage of it while you're there. It's great. And then if you get discharged and you need help when you're home, you can call lactation back, and they will definitely get you an outpatient appointment to come back in, or help you on the phone, whatever it is that you need. They're there to help you. WIC is also a great resource for lactation help, so definitely utilize them as well. If there's anything going on with baby, they might have to do some extra blood work. So if there's any signs of an infection, again, maybe something with their blood sugar or their body temperature, or if something happened during the birth that they want to keep an eye on, then they might be doing some extra things. But typically the baby's going to be in your room with you the entire time that you're there. The nursery is really just the NICU. So unless there's something going on with baby, they're going to be with you. If you had a large baby, so if your baby was born bigger than, I think it's 8 pounds and 13 ounces is like the cutoff, or maybe if you had gestational diabetes during your pregnancy, they might do some extra blood work just to make sure everything seems okay. And then jaundice is kind of a common thing that comes up. This is to do with the liver. The liver is one of the last organs in a baby's body to form, and so especially if you had a baby a little bit early, maybe you were still full term, but like 37 or 38 weeks, your baby might become jaundiced. They get sort of a yellowish color to their skin. Sometimes their eyes get kind of yellow. The treatment for this is to do UV lighting. So they basically bring in this little like tanning bed and put your baby in there. They put little eye covers on them, and they're in the room still with you, and they're just under those lights for as long as possible and as long as needed. You can still pull them out to feed them and do different things, but it's just to help them get rid of that. So usually babies are pretty good within a day or two if they are jaundiced. They'll do what's called a Bilirubin Test before you leave the hospital to check and make sure your baby's not jaundiced. And it's something that your pediatrician will sort of check in on too whenever you go to your first pediatrician appointment in the first few days. Again, if you're having any issues with feeding, sometimes babies are just really sleepy in those first day or two. I kind of always joke with clients, like everyone always thinks they have like the best baby because they're super calm and quiet those first 24 hours. And then day 2 is like, who is this child? Birth is pretty traumatic. It's a lot that happens, a lot for them to adapt to. So sometimes they're just super tired, and then it's like they snap out of it and they're a total different kid. So just like I said, like take advantage of having the help while you're at the hospital. And don't get too reliant on the fact that your baby might be super easy, because they actually might be kind of difficult, and that's totally okay. But they just might be really sleepy, and a sleepy baby can be really hard to breastfeed because you got to get them to wake up to open their mouth to eat. So some different tricks can be getting them back down to skin with you, sort of tickling their feet or tickling their back, sometimes kind of blowing on them to kind of startle them awake a little bit. Or maybe you can get them awake to latch, but then they fall asleep like 2 minutes later. So just doing what you can to kind of irritate them, to get them to feed and get a full feeding in is sometimes a good idea, because it's really tempting to just keep sleeping and to rest. The hospital will give you like a log that you'll be tracking your feedings, and you also track like their different, like if they poop or pee and different stuff like that, and you can take that home and keep using it. There's apps and stuff as well. But a sleepy baby can be a little bit tricky. If you have a baby boy and you have them circumcised, they tend to come back from that and be pretty sleepy. So just know that might be something that's kind of normal for like a few hours after a circumcision. The other couple things that they do for babies before you go home, they'll do a hearing test. This doesn't bother baby at all. I remember my second son just slept through it. They just put these things on their ears. It sends a signal in through, and it's supposed to come back out, and as long as it goes through and comes out the way it's supposed to, your baby passes and everything's good. Occasionally babies do fail this and actually can hear just fine. A lot of times it's because they have a lot of fluid inside them still, because again, they were in your amniotic fluid for 9 months. So sometimes you just need to repeat the test down the line, but this is really important to do, and it's required because you want to catch a baby that's not hearing correctly early, so that you can get connected with the resources to get things that you need in place so that the baby continues to develop normally and normal language and stuff. Bathing, the part of the Baby Friendly Initiative is to delay the bath for at least 8 hours. So you're not going to even be offered a bath until baby's 8 hours old. You can do the bath, or the nurse can do the bath, your partner can do the bath, you guys can do it yourselves, you can have help from the nurse, or the nurse can just do it, you can videotape it. It's whatever you want. You don't have to do it at all. I personally opted out of doing the newborn bath with my second son because that Vernix is really important to leave on for a little while. It's just a sponge bath, so you literally just wipe them off with a soapy washcloth, and then they just wash their hair and rinse that out. So it's definitely not something, it's not like a total bath, but it's a good idea to maybe get an idea of what it looks like if you've never seen a newborn sponge bath before. And kind of how they keep the baby warm in the process of doing it. And if you have a certain baby soap that you want them to use, I'd recommend bringing that as well. And then so the last thing that they're going to do before you leave is the PKU test. This is a heel stick. So they prick baby's heel. There's like this like cardboard, it looks like an index card, and they have circles on it, and they have to fill each circle with the baby's blood and send that in to the state for the PKU screening. This is a really rare disorder, but it's really, really serious, and so it's required to test all newborn babies in the state of Illinois. So one thing that's a little trick for that is I always recommend for people to ask for like the person who's coming to do the test to put like a little hand warmer on their foot. So like, I don't know if you guys know what hand warmers are, but it's just like a little heat pack. Put it on their foot for like 10 seconds just to warm up the area before they prick it. It just bleeds a lot better and it goes a lot smoother. If you want to hold your baby while this is happening, if you want to breastfeed your baby, feed your baby a bottle, like something to keep them distracted, they might not even cry during it. So that's my little trick, is if you can get it nice and hot, it'll bleed better and faster and it'll be over quicker and might not bother the baby very much. But again, that one is required by the state of Illinois. So release from the hospital is typically 24 to 48 hours after you give birth. That's pretty standard for a vaginal birth. Typically on the side of 48 hours, especially if you are a first-time mom or if you're having any feeding issues. If anything sort of was a little bit complicated, if you had high blood pressure, if you had blood loss, if you're showing any signs of infection or had a fever, just if anything seemed a little off, they're going to keep you the 2 days usually. But if everything's pretty smooth and you feel good and you're ready to go home, it's usually closer to 24 hours. So that PKU test has to be done at least 24 hours old. So you're usually looking at like 27 hours, and that's from the time that the baby is born, not from the time you get to the hospital. If you have a C-section, you're going to be at least 48 hours, usually closer to 72. So just plan for that, pack for that. You know, you might want to pack your stuff to be prepared for 2 or 3 days just in case you're there a little bit longer than you thought. And then the last thing I want to warn you guys is that babies lose weight. So if your baby's born at 7 pounds, 8 ounces, 24 or 48 hours later, whenever you're released from the hospital, they might be 7 pounds, 3 ounces. So babies lose a little bit of weight. A lot of times it's just like water weight. And so if they do, don't be alarmed. That's totally normal. It doesn't mean that you're not feeding well. And typically like what I hear is like 8 to 10% of their birth weight. To lose that is normal for most pediatricians. So if a pediatrician's concerned about it, they're gonna let you know, and they might keep you a little bit longer. But it is very normal for them to lose a little bit of weight. And then maybe even at that first pediatrician appointment when they're just a few days old, they might still be under that weight. As long as they're back up to their birth weight by 2 weeks old, that's considered normal. So that's just something to be aware of, because it can freak some people out sometimes to hear the baby's lost some weight. So, but they'll get right back up to that birth weight as long as feeding's going well. And then once they hit their birth weight, they typically will gain, you know, like 4 to 7 ounces a week. So it's a pretty quick weight gain. So that's just something I like to warn people of. You have to be discharged by your OB. And then the baby has to be discharged by their pediatrician. So you guys both get released. If one of you needs to stay, usually that's fine, and they'll let you have extra time. The exception would be if they didn't have a room, but typically they have the room. So I think that's everything I wanted to cover today. Thank you all for listening. I'm thinking of doing like next week on Wednesday at 4 o'clock again. I was thinking of maybe doing like ways to soothe your baby, particularly like a newborn. I don't know if people are familiar with like the 5 S's with Harvey Karp, but just some different tips and tricks to help sort of soothe a really fussy baby is what I was thinking about, kind of sharing some ideas. It's definitely, there's not like one trick for anyone that works every time, but just some different ideas of things to try, because it can be really frustrating if you can't figure out what's going on with your baby and they're crying for hours. So you guys have a great day, and I will see you next week on Wednesday at 4 o'clock. Thank you.